Hello and welcome to this channel. My name is Victoria and in today's video we are going to talk about arrhythmia of the heart. Arrhythmia is the disturbance in frequency or rhythm of the heartbeats. Physiologically, the heartbeat should be rhythmic, equal and in a frequency range of 60 to 90 beats per minute. Many patients, however, experience a disturbance in this regular heartbeat. This abnormality can be due to cardiac causes, so originating in the heart, or extracardiac causes, so from outside the heart. Cardiac causes include coronary heart disease, where the vessel lumen is narrowed, heart failure, where the heart is not able to contract efficiently, cardiomyopathies, and congenital abnormalities. If you are interested in knowing more about coronary heart disease or cardiomyopathy, you can click on the banner above. Extracardiac causes are very wide-ranged. They include, for example, electrolyte imbalances, which disturb normal muscle contraction, hypo and hyperthyreosis. In hypothyreosis, we will expect bradycardia, while in hyperthyreosis, we will expect tachycardia. Intoxication with medications, as well as not medically used substances, hypertension and accidents with electricity are other examples. Arrhythmia is classified into four major groups. Bradycardia, which describes a slow heart rate of under 60 beats per minute. Tachycardia, which describes a fast heart rate of over 100 beats per minute. Supraventricular arrhythmia, which describes rhythm disorders originating in the atria, and ventricular arrhythmia, which describes rhythm disorders originating in the ventricles. Bradycardia can be further divided into sinus bradycardia, which occurs in a sinoatrial block. Here the patient has a slow but regular heartbeat. This is observed when the sinus node generates impulses too far apart from each other. Another rather rare variation is atrial flutter with a slow heart rate. This is possible when the atrioventricular node is blocked. This makes the heart not able to pump enough blood to the peripheral tissues, and this can be fatal. Another form of bradycardia is the respiratory sinus arrhythmia. This is physiological, especially in young adults. Here the heart rate is synchronous with breathing, and the heart rate is faster in inspiration and slower in expiration. Also, disturbances in the conduction of impulses can lead to bradycardia. Examples for those are the sinoatrial block, where the impulse from the sinoatrial node are not led further properly. This leads to abnormal depolarization of the rest of the cardiomyocytes. Also atrioventricular block, where the impulses from the atria are not led further to the ventricles, is a cause of bradycardia. Tachycardia is divided into ventricular and supraventricular causes. In ventricular tachycardia, the origin of disturbance is found in the ventricles itself, more specifically in the Purkinje fibers and bundles of His, which should distribute the impulses over the entire ventricles. If the origin is in the atria, it often is due to overproduction of initiation signals in the pacemaker cells of the SA node. Supraventricular rhythm disorders can be sinus tachycardia, where the patient has a regular but too fast heart rate. Supraventricular extrasystoles are extra impulses which lead to arrhythmia. They can occur in healthy people as well as they can be a sign for pathologies in the heart or outside the heart, like electrolyte imbalances. Paroxysmal supraventricular tachycardia is by definition the spontaneous occurring tachycardia originating in the atria. This can be atrial tachycardia, a regular but fast heartbeat, as in hyperthyreosis, or some medication intoxications. Also an example is AV not re-entry tachycardia or AV re-entry tachycardia. This is the most often observed type of supraventricular tachycardia, where the AV node sends initiation signals too often, leading to a progressively faster and faster heartbeat. The episodes start and end suddenly. Ventricular rhythm disorders include ventricular extrasystoles, where an additional impulse is generated outside the atria. We call this an ectopic initiation impulse. This phenomenon can occur in healthy patients as well as patients with cardiac disorders. Ventricular tachycardia is another form of rhythm disorder. It is life-threatening as the ventricles contract by a signal originating from the ventricles themselves. This leads to overstimulation of the ventricles and is cause of sudden cardiac death. Another form is ventricular flutter, which can sometimes be observed after a myocardial infarction. Here, the cicatrix prevents the ventricles from contracting normally due to improper impulse conduction. This disorder is characterized by a heart rate of over 250 to 350 beats per minute, so immediate defibrillation and cardiopulmonary resuscitation is essential. The last type is called torsade de pointes tachycardia, or torsade de pointes, depending on how you want to pronounce it, which is a ventricular tachycardia. On the ECG, it produces a characteristic image with waves spinning around the isoelectric line with a frequency of over 150 beats per minute. Every 5 to 10 beats, they change their amplitude. It can be due to extrasystoles, which are originating in the phase of repolarization. It is associated with QT interval prolongation and is often resolving spontaneously. As mentioned earlier, arrhythmias can be due to abnormalities in impulse formation or abnormalities in impulse conduction. Also, re-entry mechanisms are possible when an impulse is not resolved after traveling through the heart, but persists and continues to follow the conduction system after the refractory period. Also, it is possible that every individual cardiomyocyte functions abnormally and develops an autonomous impulse formation. Now I want to talk about the associated symptoms. Depending on the kind of arrhythmia, the symptoms differ. But in general, patients do often not experience a lot of symptoms. In tachycardia, patients experience a fast heart rate, which some describe as feeling like their heart is about to jump out of their chest. Bradycardia is usually asymptomatic. In supraventricular and ventricular arrhythmias, patients often feel palpitations, which is as if their heart skips a beat, or the heartbeat feels stronger and irregular. The decrease in pumped blood per minute can lead to a series of symptoms. Those are symptoms of heart failure like fatigue, dyspnea, and exercise intolerance, but also dizziness, syncopes, cardiogenic shock, and angina pectoris. If you want to know more about angina pectoris or heart failure, you can click on the banner above. Disturbance in normal cardiac function can also lead to the formation of arterial emboli, which can lead in turn to organ infarction and stroke. How is arrhythmia diagnosed? First of all, as always, a thorough anamnesis gives us an idea of the condition the patient is in. After that, we can do a series of different kinds of ECGs. Those include an ECG at rest, a long-term ECG, which is obtained over weeks or months, sometimes by the help of an implantable device, and also the cardiac stress test, in which the patient is asked to exercise on a bicycle in the doctor's office while the electrocardiogram is written. Another test is the echocardiography, where we can see the size and shape of the chambers, as well as the blood flow and movement of the heart so arrhythmic movements will be made visible, as well as cicatrix formation. The last test is to obtain an X-ray of the chest, in which the size, shape and location is visible. This can help if the arrhythmia is due to cardiac disorders. When a patient is diagnosed with arrhythmia, it is necessary to treat the condition. This is done by antiarrhythmics, but I'm sure you want to know a little bit more. The antiarrhythmics are divided into 4 groups, depending on the type of channel they affect. We differentiate sodium channel blockers, beta blockers, potassium channel blockers, and calcium channel blockers. Also, it is important to figure out if the patient has any underlying condition as heart failure, hyperthyroidism, or electrolyte imbalance that causes the condition. Then treatment of the underlying pathology is important. In some cases, also electrotherapy by an implantable pacemaker is important to avoid sudden cardiac arrest and to help the heart to find back to a normal rhythm and frequency. If arrhythmia is not detected or is being left untreated, the patient can experience severe complications like stroke, heart failure, sudden cardiac arrest, and organ infarction. That's it for this video. I hope it was helpful and I would be very happy if you could subscribe. Thank you very much.